everyone, welcome back to our channel. I'm Dr Amel from City Skin Clinic, and today I thought I'd answer your most frequently asked questions about lip fillers. These are questions that I see all the time, whether they're in clinic, whether it's on this channel, and also when people reach out to us on our Instagram, and also the comments that are left here on YouTube. So I hope this is going to be useful. And before we get started, if you're new to our channel, don't forget to subscribe to this channel and ring the notification bell. If you are a returning visitor, welcome back and thank you so much for your support. So let's get stuck in. These are the most frequently asked questions, so the 5 top questions that we get asked about lip fillers. So the first one is, are lip fillers safe? So of course this is a really important question, and safety is the most important thing, especially since these treatments they're cosmetic, they're there to make you look good, they're there to make you feel good, so safety is paramount. So lip fillers are safe with the following caveats, so that they're performed by a medically trained and experienced person who is going to make sure that they don't do anything silly like inject it into the wrong area, inject it into a blood vessel, cause mayhem. They're going to use an aseptic technique that's going to reduce the risk of infection, and they're also going to provide follow-up and make sure that nothing goes wrong. The other thing is that it needs to be a reputable person, reputable clinic, because lip fillers are only safe if they're the right kind of licensed brands of lip fillers. There are in the UK over hundreds, so over 200 brands of filler circulating around, and I can tell you that only a small handful of fillers are from reputable companies that have done the experiments, that have the years of use and the safety record. So companies like Allergan, who make the Juvederm range of fillers, you've got Belotero from Merce, you've got Restylane, you've got Teosyal. All of these are really leading brands, and so you need to make sure that when you choose a clinic, you ask about which fillers they're using. And it's not an exhaustive list. There are new fillers that come all the time, but you just have to make sure it's something that's got a good established safety record. It's a reputable company. A good way to know if something is also well established, to look if it's been FDA approved, and also who else is using it as well. Because the filler is going to be in your body for some time, and it goes without saying, if you're injecting filler into the face, it absolutely has to be hyaluronic acid filler, because it can be dissolved immediately should the worst case scenario happen and there's a problem. So these are the main ways you can ensure that it's a safe procedure. And of course, if you go to a medical practitioner, they'll also make sure that there's nothing in your medical history that is going to mean that the filler is not the right treatment for you. So that's the first question, and I hope that kind of little summary is useful. The second question that we get asked all the time is, does it hurt? So, no, it shouldn't hurt, but again, as long as the following is observed. So, anytime you inject anything anywhere, there's going to be a needle going into the skin, and that is going to potentially hurt. How do you reduce, minimize discomfort or this pain? Number one, it's using an anesthetic. So we, for example, offer everyone who is having any kind of treatment that involves puncturing the skin, we use as a minimum local anesthetic. So it's a numbing cream that goes on the skin, the area that's going to be treated, and it numbs the area so that the treatment is not painful. The other thing that happens is most of the leading brands of filler have anesthetic inside them. Don't listen to anyone who says it's fine, we don't need the numbing cream, the filler has the anesthetic. No, you need both. The numbing cream stops the initial entry of the needle being sharp and painful, and then the anesthetic in the filler itself numbs the lips from the inside, so it makes injecting inside the lips less painful. So that's the combination of the two. We also offer for patients they just can't bear the needles, they can't bear the idea of being aware of what's happening. You can also use a dental block. So when you go to the dentist and they numb your mouth and your lips and you can't feel them, and after a while you can't talk properly, sometimes you might drool a little bit. We've all been there. That is what we can offer. And again, most people don't want it and most people don't need it because it's another set of injections, and most people, the numbing cream kind of goes away after half an hour, 45 minutes. Your lips, you can feel them again. With the dental block, it can last for a couple of hours or more. So really for most people, they don't want that inconvenience, but there are a few patients who really just want to not feel the treatment at all. And then I think a dental block is great. And so I think if you're someone who knows that you really can't bear injections, etc., discuss with your practitioner the possible options. One of the things that we do if someone's unsure is we try the numbing cream, and if they think that actually, no, even with the numbing cream I don't like it, we switch to the injection, the dental block. So find, especially if pain is going to be an issue, needles, you're worried about that sort of thing, find an experienced medical injector who is able to perform all the different types of anesthesia. So no, it shouldn't be painful. You can make the treatment comfortable. There are also other things after the treatment that we do to help reduce the discomfort. So after lip filler, lips may be a bit bruised or swollen, so we give patients a little ice pack to take, and that helps reduce that swelling and that reduces that discomfort. So it's just about having all these options available, and we think pain, I think that's such an important part of any treatment to consider it, because if you're in pain, you're just not going to enjoy the treatment even after the treatment has finished. All you'll associate with it is the pain. So there's no need for anyone to be in pain for an elective cosmetic treatment. So those are the options that you have with lip fillers in terms of pain. I know there are also other things. Some doctors will use one of those vibrating machines that kind of helps cause a distraction. I think those, probably they also work, but it's just what's available, and what's effective. We know numbing cream, we know dental blocks, but even if those vibrator things help, that's also fine. It's just about knowing that you don't have to be in pain during this procedure, and actually if you're in pain, that's something that we would worry about and check, because it's not a painful procedure if done correctly. So the other really frequently asked question is how long do lip fillers last? So lip fillers, how long they last will depend on a couple of things. Number one is the type of filler used. So commonly used fillers like Belotero lips, like Juvederm, Ultra Smile, these will last for about kind of 6 to 8 months on average, depending on your lips, how mobile they are, etc. But on average, they last about 6 to 8 months. Then you have some slightly longer lasting fillers like Juvederm Volbella. Some places may use it, I know in the US especially, Volift or Voluma, and these can last up to 12 to 18 months, so they last a bit longer. Of course, also how much filler you have as well, because even as filler starts to dissolve, if you've had several mil of filler, obviously done over a period of time, it may feel like they will last a little bit longer because it's a stage procedure and there's more filler to go, rather than if you'd had half a mil of filler, for example, you'll notice that go down quicker. The other thing that it depends on how long they actually last is you. So your metabolism is a big player. Hyaluronic acid dermal fillers will dissolve by themselves, and they get broken down by your body, and then they get absorbed. And so people with a faster metabolism may break down the fillers faster. We know especially people who are quite sporty and athletic, they have a likelihood of breaking fillers down faster, and sometimes it's just your genetics. So that you can't really control, and you'll only really know when you have fillers done, but that's just as a general guide. Most commonly regular fillers about 6 months, maybe a little bit more, maybe a bit less. Things like Volbella and longer lasting fillers up to 12 months, maybe a bit more, a bit less, just depends. And then as a follow-up question to that, we get asked how much filler can you have, and how often can you have filler. So this is an interesting question. So how much filler can you have? To be honest, the volume of filler, especially lip filler, is not so much important as is where it's placed and how it's placed. So most people we see in clinic only really need a mil of filler to achieve a nice bit of natural looking definition, enhancement, and a little bit of, shape. Some people, if they have incredibly thin, small lips and need more of a boost and need a lot of reshaping and volume, will need more than that. They may need 2 mil of filler, they may need 3 mil of filler. Now that is not to say you would never put 2-3 mil of filler at the same time. You're not going to get a nice outcome for that. But in that situation, someone might come in and have, for example, treatment with 1 mil of filler, and that kind of establishes the baseline. It does a bit of shaping and it helps kind of set the foundations. And then a couple of months later, once all of the swelling has gone down and the filler has settled, have another mil of filler, and that helps build up the lips. Either that second mil of filler is enough, or if we're really doing a lot, maybe they come in again in another month or two once everything settles down and they have the last phase done. That gradual approach is really great if you're looking to build up very, very small lips that don't have much shape, not have much definition, to something that's really beautiful and very structured and very, naturally enhanced looking. That you would need to do it over time. And to be honest, it's much better over time, because someone might think they want a certain outcome, but actually if they see what's been done with less, that might be enough. So you can always add more filler, but it's really hard to take it away without having to dissolve everything. So this gentle approach is better. It also makes it easier if you're a bit shy about telling people, letting anyone know you've had, if you're going gradually up, people don't notice it as much. So that's the approach. So actually the amount, I would say it's more about not having too much in one sitting. That's not great. I would say 1.2 mil maximum in one sitting, and then later building up on that result in a month or two, probably 2 months, to have everything come down. And then how often can you get filler done? So I prefer for the filler to start kind of dissolving before we add the next amount to basically maintain the outcome. I know some people really don't want their lips to start going down, but the problem is if you think, okay, this filler should go down in 6 months, so at 5 months I'm going to come and have the treatment so that there isn't an interval between them kind of dissolving and then coming up again. The problem with that is you don't know, the filler may take longer to dissolve, and in that scenario you've ended up with bigger lips than you had before. Sometimes it may distort the lips because as that old filler is still there and it's still kind of in a sufficient volume, it just doesn't help you get the best outcome, and you can end up with too much swelling, too much puffiness. You can end up with having a really unnatural looking result, some migration. So what I generally say is when you start noticing a difference in the appearance of your lips, and that's with filler anyway, that's generally the time that you can start considering coming back and repeating the treatment, because most of the time filler will have started to dissolve long before you've noticed a difference, and by the time you have, that's usually a good time. And the reason I keep it a little bit vague like this is also because for some people that may be much longer than the average person's filler going down. So if it's still looking great, leave as is. And then once you've started to notice, and of course this is why it's also really important to have a regular clinic and the same practitioner treating you, because they'll also be able to honestly say, and we do this very often, you know what, maybe wait another month or two. I think we'd have a better time of it if you waited a bit longer. So that's a really, really important thing, and bear in mind, if you're someone who regularly gets fillers, that distance between the treatment and then having to redo it may get longer over time. For some people, the filler, you want to avoid it kind of building up or for some people it stimulates collagen, and so the result may last for a bit longer than it had previously. So that's another reason to kind of take a watch and wait approach. The last question that we get is, how old do you have to be to get lip filler? So we always held the line before there was a law in place, ever since we started the clinic, that actually no one under the age of 18 should be having these treatments. And to be honest, we generally prefer people who are 21 and over. The reason for that is, I think under 18 you are legally a child, and you are growing. There's so much happening in your life at that time, and it's not abnormal for young people to feel the pressure to have to look a certain way, even if maybe they don't necessarily want that change. And so for us, morally and ethically, we always said no to anyone under 18, and to be honest, we much preferred people that were 21 and over, although we did make an exception for 18 to 21 if someone we knew was kind of mature, had been thinking about this for a long time. This was a decision that was based on kind of a lot of logic. So sometimes you'd have people who maybe had scarring and then you wanted to fix that appearance, or or they've started working and they've had more responsibilities, but this is something that despite all of that they've thought about. It's not to be patronizing, but the big thing is, it's important to remember that your face and your body continues to grow even into your 20s. Your face and your bone structure will continue to develop, and so it's really important that when we perform these treatments, we respect that there may be changes happening. So it's really important for us that our patients at any age are having these treatments because they've made an informed decision, that this is a positive experience. These treatments are supposed to make you look and feel good, but they can only do that if you're going in informed, if you're going in from a position of being empowered, and no one's coercing you into this. There's no pressure to go into it, and really it's part of your general self-care basically. And so we really don't feel that when you're younger than that, certainly under 18, you're really not going to be in a position to do this. And even that space between 18 and 21, we take it on a case-by-case basis, because we always want everyone to be acting from a place where they are they're going to benefit from this treatment, and it's not something that's going to do them any harm, especially if the face is still developing. And the law in the UK has caught up with us. So last year the law was changed so that actually it's illegal to perform fillers for anyone under the age of 18, and that couldn't have come sooner enough. Life's already incredibly tough if you're a kid without the pressure to go and have cosmetic treatments. So I would say if you're in the UK, you cannot have lip fillers or any type of Botox or filler if you're under the age of 18, and really in our clinic, if you're over 18 but you're under 21, then we're going to go on a case-by-case basis, because we generally think it's better if you are over 21. If you have any questions about lip fillers or anything else aesthetics related, please leave a comment below, and if you like this video, please don't forget to give it a thumbs up. I'm going to leave links to related videos and related pages from our website, our guides about lip fillers, that will answer some more of your questions. And if you haven't done so already, please don't forget to subscribe to this channel and hit the notification bell. Until next time, see you.